cancers usually increase in size, definitely. But what makes cancer different from a polyp is its ability to spread. There are different ways of staging it. There is the Duke's classification, which is staged as A, B, C, D. And there are other ways, you stage it 1, 2, 3, 4. Whatever the type of staging we use, it tells us and indicates us how big the size of the lesion is, and also whether is there a spread. Spread is a medical name is called metastasis. Now, if it spreads to other organs such as the liver, the lung, the brain, and to the bone also at the same time. So if it grows in those areas, then you would have signs and symptoms of that area being impaired. The common signs of colon cancer, you'll be surprised, is completely no signs and symptoms at all. That means a patient is asymptomatic. Because for cancers to show itself, it really takes some time. And usually what we refer to as the polyp cancer sequence, where there's the emergence of a polyp, which is a tiny tumor that can grow in the colon for various reasons. Most of the time it's just purely age. Once you reach the age of 40 and above. For some of us, we have this propensity of developing a polyp. Now, not all polyps become cancerous. However, those that have the ability to grow bigger and to evolve into a cancer, it takes about 10 years for a polyp to become a cancer. So if, let's say, a polyp appears, usually the patient doesn't even know he has one. As it grows, then you start to have these symptoms of a thing that is obstructing. So patients usually will complain of maybe a change of bowel habit, abdominal bloatedness, very seldom pain, because once the patient experiences pain, it is a very late sign. That means the cancer has invaded into surrounding structures and involving the nerves, so that the patient experiences pain. If the liver is affected, then you may present with pain where the location of the liver is, or loss of weight, loss of appetite, or jaundice. For spreading to the lung, sometimes it could end up with a breathlessness for a patient. For patients with spread to the brain, it can manifest as a fit. For spread to the bones, a patient may complain of bone pain. Another common sign of colon cancer is actually bleeding, and therefore a lot of people equate this common condition called hemorrhoids or piles to cancer. In a way, it is good for the patient, because if the patient complains of bleeding when he passes motion, it will bring to the attention of the doctors. Usually, first line would be a family doctor. Sometimes it's the patient can quantify the amount. That means it's a large amount or a small amount. Especially in a patient that's aged between 40 and above, would be a recommendation for this patient to go for a colonoscopy. The colonoscopy is good because you will be able to visually exclude things like polyps. You can exclude things of infection, cancers, and even have the ability to biopsy it. A biopsy is when we can take tissue samples of the growth and test it, so that we can confirm that it is a cancer. Colonoscopy should be the first line of screening for the patient, and should we pick up that it is confirmed it is a cancer, then CEA or the carcinoma embryonic antigen levels are being tested, and that will assist us in the subsequent treatment for the patient, because we know that when a cancer is removed surgically completely, the CEA levels drop to normal levels. It is adequately cleared.